Greetings, Ma'am Jasmine. Once again, I am Arjun Angeles, one of the first year nursing student of our college. Today, I will be assessing my client's peripheral vascular system. Thus, without further ado, let's start with it. Assessing my client's peripheral vascular system are important as it provides valuable information about her veins and arteries. And of course, the considerations to be made are first, for the infants, we must screen for the coarctation of aorta by palpating the peripheral pulse and then compare it with our femoral pulse. Second is for the children, we must screen for any bruising or purpura as any of these two can be a possible indication that our client might have a serious systemic disease like leukemia. Third is for the older client, the efficiency of blood vessel might be decreases as the smooth muscle cells are being replaced by connective tissue. So now let's do the preparation. So first things first is, of course, we are going to perform hand hygiene so that the microorganisms lodging onto our hands will be removed and not transferred to our client. And then after that is I will be now going to introduce myself to my client, explain the examination, and give them instruction. Okay? So good day, ma'am. I am Ara and I will be your nurse today. So today, ma'am, I will be assessing your peripheral vascular system po, no? Or yung system po sa katawan natin na nagke-carry ng oxygenated blood into our peripheral part of the body, or ito pong hands natin, and then dito po, and then sa lower extremities. Okay po ba yan? Nagke-carry din po sila ng deoxygenated blood, pabalik naman po sa lungs natin, and then sa heart. Okay po? So, a little later, ma'am, I will be going to use my eyes po, no, to inspect those areas that I said. So, wag po tayong mahihiya kung titignan ko po kayong mabuti para lamang po ito ma-assess kung may specific condition po ba na kailangang i-note si Nurse Ara. Okay po ba? And then, I will palpate din po, no, may hahawak-hawakan ko po kayo. Will that be okay with you po?
Opo.
Para po makita natin kung meron po bang specific na sensation na kailangang i-note. Okay po ba? So now, ma'am, let's get subjective data. So once again, I am Ara, I will be your nurse today, and I will be getting subjective data to you. I will be asking some personal questions regarding your past and present health history. And as I do that, I will be taking down notes for our reference, ma'am, no? Rest assured naman po na lahat ng data na magagather natin dito I will be remain confidential between me as your nurse, you as my client, and then the physician I will be referring me to. Will that be okay with you, ma'am?
Opo.
Okay. So, for verification, ma'am, can I get your name, please?
Jara po.
Okay. When is your birthday?
October 3 po.
Okay. So, meron po ba tayong napansin na changes sa skin natin?
Wala naman po.
Kahit po sa color, may specific po ba na araw na bigla na lang napansin natin na umitim, ganyan?
Wala po.
How about po sa temperature? Warm naman po ba siya lalagi? Hindi naman po ba siya dry?
Opo, lalawal po.
No, warm po siya. Okay po, no? How about po yung sa texture? Hindi naman po ba siya magaspang?
Hindi po.
Okay. Gumagamit po ba tayo ng mga lotions?
Opo.
Okay, that's nice po. No? Continue natin yan. About po sa leg pain, may nararamdaman po ba tayong sakit sa legs natin? Like, medyo mabigat po ba sila?
Hindi naman po.
Wala po ba tayong instances na bigla tayong nagigising kasi nagkaroon tayo ng leg cramps?
Hindi po.
Okay, wala naman po. Okay, no? Wala naman po ba tayong leg veins? Like yung parang bulge po na nakalagay?
Wala po.
Okay, that's nice po. How about the other? Parang may rashes po kayo, ma'am.
Nangangati lang po ako minsan kapag naanalamok.
Alamok po. Okay. Okay po, how about wala na din po naman to tayong swelling sa pit, no? Tignan ko nga po.
Wala naman
Okay po.
po.
The other, wala naman po, no? Wala naman po ba tayong problem sa circulation ng blood sa arms and legs natin?
Wala po.
Wala naman pong history?
Wala din po.
How about po hair loss?
Wala
Wala naman. Pang ganda nga ng hair mo, ma'am, ang haba.
po.
Okay, so sa history po ng pamilya, may nagkaroon na po ba ng heart disease?
Wala po.
How about po mataas ang cholesterol?
Wala din po.
Okay, very good. Triglycerides po, meron po ba?
Wala po.
Wala po, kahit po si mami?
Opo.
Okay. Wala naman po ba tang nagsisigarilyo sa bahay?
Wala po.
Nag-exercise po ba tayo?
Yes po, 3 times a week.
Okay, very good. So now we are done getting our client's subjective data. So now let's start the inspection, particularly for the skin. We are going to inspect the color, the varicosities, the extremities, hair distribution, edema, ulcers, as well as the size disparity. Okay, so let's start. Okay. Okay, ma'am. I can see from here that you have a lightened skin color, no varicosities, like veins bulging into your skin or veins becoming enlarged. And then, okay, can you move down? Upo po tayo. Okay, the hair are just fine. It is equally distributed. Okay, move now. Okay, now. And then here I can also, from your feet, I don't also see any edema and then ulceration, even in the upper extremities. And then of course, no size disparity. Then after that is we are going to inspect the jugular vein for the pulsation and distribution. So let's start. Okay, I can see from here that it is flat with no distension, and it seems like a double diffuse pulsation of the right internal jugular vein at the sternal notch. That's very good. So now let's start the palpations of the different pulse site. So now let's start with the carotid. So the carotid is positioned here along the medial edge of our client's sternocleidomastoid muscle in the neck. Okay. Wait for a while. Okay, so this muscle are palpated mostly during the cardiac arrest or when other sites are not palpable. Okay, wait. Okay, how about the other one? Okay, here I can say that it is easily as expected. It is full and easy to palpate, so that is 3 plus, okay? So now for the temporal. So it is over the temporal bone of our patient head. And then he's going to palpate it. Okay. Dinig na dinig siya. It is a normal pulse in that side. How about here? Okay, good. That is also a normal pulse. So it is 3 plus. Let's read it at 3 plus. So now for the radial. So here is there our patient radial. So this artery is here. So this artery branches off from the brachial artery and helps to provide circulation to our arm and hand. Okay, so we use this measuring pulse rate in adult. Wow. Okay. I can say that you have a strong and firm regular radial pulse. How about the other? Okay, similar. So it is 3 plus. So now to your brachial. So for your brachial, so this brachial is the major artery found in the arm that we use to when we are assessing our patient blood pressure, okay? No, you just straight your hand like that. Don't. Okay. How about the other? Okay, I grade that at 2 plus. So now let's move to our patient's popliteal. So this branch off from the femoral artery and is located here behind the knee. So to find this pulse point, we're gonna flex the knee like this, and then we are going to take the both of our hands and then put it here behind the knee. And then we're going to find it here at the midline of the popliteal fossa. So, okay, let's this side first. So it is pretty deep, so the positioning of the knee like this will help us find it. Okay, I will grade it on 1 plus since there is a faint but detectable pulse. How about the other? We're going to do a deep palpation here. Okay, just like the other 1 plus. So now our patient's dorsalis pedis. So it is located here at the top of our client's foot between the extension of tendons and first toe. Okay, so this is the site used to assess the status of circulation of foot. I'm going to locate it here. Okay, how about the other? Okay, it is 3 plus. It is very easy to palpate.